All right, are we live? I think we're on. Come on, Instagram. All right, Instagram's going live too. What's up, everybody? How are y'all doing? It's Dr. David here from El Paso Manual Physical Therapy. I am going to be solo today, doing my workout, answering some comments with you guys. I have got deadlifts today. Got to work on my glutes on my deadlifts. And then I've got to do some sit-ups, weighted sit-ups. And then I've got to do calf raises. So I'm going to start with my calf raises right now as I start. We already have some comments on here. So just to give you guys kind of the ground rules, or more so like the procedure here, what we usually do, just our drill, if you will. I will be working out. I'll be answering some comments along the way. We're live right now on YouTube, on Facebook, and on Instagram. And on YouTube and Facebook, I can see your comments. We're using this software. It's called StreamYard, and it integrates the comments together. It allows us to stream on all three places at the same time. I just cannot see you if you're on Instagram. Sorry. Love my Instagram people, just the software isn't there yet. So I can't see you guys if you comment from Instagram. But Facebook and YouTube, I see you. You're here. Who we got? We got, I am so sorry, I can't say your name. I'm going to call you B. Sir, please provide some additional chondromalacia patella exercise right now. I can't spend some money, and I am a student from India. Please give some additional exercise. Oh my gosh, B, we have so much chondromalacia patella stuff on YouTube already. So go look up our playlist. It's called Chondromalacia Patella Help, and there's got to be a dozen, if not dozens, of videos there. So so we're there. Don't worry. Oh, somebody gave us a super chat already. Paddle and Fish. Hey, thanks, Paddle and Fish. Man, that's a nice sized fish you got there. Look at that. And the beard to go with it. Oh my gosh, I love that. Hey, thank you so much, Paddle and Fish. I appreciate the super chat. So speaking of super chats, the way those work, if you're on YouTube, you can post a comment with some money behind it. There's a super chat option where you go to post a comment. And if you have a question, I'm happy to answer it real fast if you do a super chat. Otherwise, I'm just going to be going down the list here as you guys come in and drop comments in. But if you leave a super chat, I'll go to your comment next as soon as I'm done answering the one that I'm currently on. So in case you want to do that, you can. No pressure. Let's see who's next here in my list. B has another comment here, and your previous video helps me a lot. Thank you. You're welcome, B. We try to also comment. I'm sorry. We also try to link in the descriptions of our YouTube videos the playlist that could be helpful for you. So whenever we're, in other words, if we're producing a video that's for chondromalacia patella, for instance, we add it to the playlist of all the other chondromalacia videos, and then we'll link it in the description. But you can always go to the homepage of YouTube, and we're starting to do this on Facebook too now. We're building playlists out, and as we add videos onto there, our library isn't as extensive on Facebook as it is on YouTube, but we're starting to build that out on Facebook as well. So just go in and search, or you can also just search on YouTube at the top, the search bar, type in Chondromalacia Patella, El Paso Manual Physical Therapy, and you'll find all our videos that way as well. All right, who's next here? Let me start on my calf raises here as Saad. Hey, Saad. Is there a radiographic diagnosis for tunnel stenosis syndrome? Thanks. Tunnel stenosis. I'm trying to think of what body part you're talking about. Probably the spine, maybe carpal tunnel. There's a tarsal tunnel. There's a lot of tunnels. I don't know that the X-rays will tell you that. They can see the bones and the openings in them, but they can't see the nerves. And so an MRI is probably going to be the better radiographic imaging that you're going to have to get to figure that out. And your doctor that does the MRI, the radiologist, is going to be the best person to tell you whether or not they can diagnose it through through radiographs, which would be like an MRI. So I hope that answers your question. All right, who's next here? Paula. Hey, Paula Hall. Hi, I am a 70-year-old active horseback rider with a 1.5 centimeter supraspinatus tear. Oh, sorry. I've had much physical therapy, but still chronic discomfort. Can you give me any suggestions? Thank you, for all you do. You're welcome, Paula. We're happy to help. Well, when it comes to rotator cuff tears, that's what she's talking about. The question here is about a 1.5 centimeter supraspinatus tear, which is one of the rotator cuff muscles, the most common one that gets torn. It's the one that's like right on the top right here, and it goes out to the corner of the shoulder. That muscle and tendon is used when you're reaching up overhead. It's used in all shoulder motions, but that's probably when you strain it the most, when you're reaching up overhead. And so its job is not to pick up your arm up overhead. It's to stabilize the ball into the socket. It sucks the ball into the socket. This is one of the biggest things that I need to fix in the way we think about the shoulder. But when you're trying to recover from a tear, what needs to happen that's really important for you to do, Paula, is make sure that you got your shrugging muscles involved in every overhead lift. So in other words, whenever you're going to reach up with this arm, you should shrug like that. As soon as you do that, and you might try it at a lower level, find out the level that works best for you. But like if you come up, if you raise your arm up to the point where you start to get a little bit of pain or discomfort and then shrug, it oftentimes minimizes the pain, if not takes it away completely. And as you train your shrugging muscles to shrug every time you reach up, it gives your supraspinatus tear less tension and it allows it to heal over time. This is how you can prevent the next rotator cuff tear or that same tear from progressing and getting worse. So you have to get your upper trap muscles involved in overhead reaching in order to take pressure off rotator cuff tears. Hope that helps you out there, Paula. Lessnessful. Interesting name. My left hip is externally rotated, and I have anterior pelvic tilt with left hip arthritis. All right, let's tackle this one. Let me just get it right. My left hip is externally rotated, and I have anterior pelvic tilt with left hip arthritis. Sorry about that. Well, if it's externally rotated, that's not always a bad thing. I wonder if maybe the arthritis is causing you to do that, but I usually tell people to externally rotate. The anterior pelvic tilt, let me talk on that for just a minute because that's something that I don't talk about much. In the physical therapy, medical research, there's a good amount of research put on what's called the pelvic tilt. Let me show you what I mean here. So if you see where my hands are on my hips, this is an anterior pelvic tilt, and this is a posterior pelvic tilt. Anterior, the way I think about it is you're sticking your butt out whenever you're doing an anterior pelvic tilt, and your gut sticks out too. So you're just kind of lazy standing, butt sticks out, gut sticks out, your butt and your gut stick out. That's an anterior pelvic tilt. And what happens when you do that is your abs aren't working. This is why I tell people to work on the lower abs, because it gives your pelvis stability. So as soon as you tuck your butt in, you feel your butt muscles work, and you should feel your lower abs work if you can engage both the butt and the abs. When you do that posterior pelvic tilt, which I never call it that because people don't understand that. I just tell them, fire your glutes. That helps you to get your pelvis in the right position into a posterior tilt. It puts your hip joints in a better position to work from, and it helps hip arthritis. So the glute idea that I talk about with helping hip arthritis, it's partially helping you get into a better pelvic tilt, a posterior pelvic tilt. So work on those glutes, Lessful. All right, who's next here? Kimberly. Hi, Dr. Dave. Coming at you soon with the super chat. Appreciate all you do for us. Oh, thank you, Kimberly. I'll look for it. Do we have any? Has it come in yet? Paddle and fish is the only one so far. All right, well, whenever you're ready, Kimberly, no pressure, y'all. I just want to make sure to answer as many questions as I can here, but I know some of you guys like to support the channel, and we'll gladly take it. We have a lot of staff growing. We're trying to put more videos out, put more programs out, be able to do stuff like this, and so your support all helps that. Thank you guys so much. Mike Allen says, Mike Allen. Hey, Mike Allen. Glad you're with us here. Paddle and Fish says, oops, first time doing a super chat. Hey, well, thank you. I appreciate it. Paddle and Fish, if you have a question, I'll see if I can find it as I come across the list here. MZ Vaughn 2S, how long will it take me to recover from a meniscus repair or cutout? Oof, good question. I'm gonna answer that one as I'm setting up my deadlifts. I got my bar out. Let's see if I can get it in the frame better here. how long does a meniscus repair take, or a cutout? So I think you're asking, like, how long does a meniscus take, a meniscus repair take to heal from, or a meniscectomy, which is where they cut out a chunk of the meniscus, which is not a repair. It's actually a different situation. All right, we need some 25-pound plates to start off. So meniscus repair, just to tell you how that works, whenever you have a meniscus tear, there's different kinds. Sometimes you have a flap. So the meniscus are two C-shaped structures like this, and sometimes there'll be a flap that's kind of like that, like my finger that's moving right here, and they'll sew the flap back to the rest of the meniscus. That would be a repair. The repair takes a long time. Different doctors, depending on the surgery they do, they take different time frames. The most common that I've seen has been over 6 months, like 6 months or more. And they don't do as well because the repair comes undone, because it's a joint that you have to walk on. In my opinion, I think if they tell people to stay off their leg longer, it'll probably heal quicker and better, but people get back to walking too fast. So they actually don't do that many meniscus repairs. What they do more so is meniscectomies, which is where they take it out, where they cut it out. That flap that I was talking about, they just cut it out completely. They remove it. And the recovery is quicker for that because you're not having to reattach anything. You're just recovering from the incision that was made to remove the flap. So usually they'll say 2 to 3 months for the recovery time on a meniscus tear. On a meniscus repair. Getting my words all jumbled up because I'm thinking of weights. 2 to 3 months for a meniscectomy, where they cut off a chunk of the meniscus and it's not there anymore the rest of your life. That is the faster recovery time. But what you need to know is that surgery, I think it's going to be phased out eventually, because they're already doing research studies in Europe where they're showing that you can have a placebo meniscus removal surgery, the meniscectomy, and have the same result as if you didn't have the surgery, as if you had a placebo surgery. So they're questioning now, is that even necessary? Plus, on top of that, they found that the rate of arthritis shoots up in the people that had the meniscus cut out, a chunk of the meniscus cut out. So I think it's just going to be found to be more and more dangerous or more harmful to do the meniscectomy surgery, because it's messing up people faster, getting them towards a knee replacement sooner. I can't wait for those studies to come out, but think of how long it's going to take. It's going to take decades to get that kind of research out, where somebody is somebody who we know had a meniscectomy and then got arthritis sooner than normal, and then got a knee replacement sooner than normal. Like, I don't know if we're going to see that research anytime soon. It's going to have to be a few years for that one, like a few decades probably. So to give you the short answer, the meniscectomy where they cut it out, you're looking at 2 to 3 months. And the meniscus repair where they reattach it, you're looking at 6+ months. Probably should be more like a year to recover from that one. And honestly, you're better off fixing the muscle imbalance. That's why we made the meniscus recovery program, the meniscus tear recovery program, because that's what's going to give you the best long-lasting relief. You have got to get the pressures right in your meniscus in order for you to not compress it too much and cause it to tear. And there's so many people that get a meniscectomy procedure and then tear it again. It's because that root problem's never fixed. You have to fix the root problem. That's what surgery doesn't do for you. All right, I hope that answered your question, MZ Von 2S. We got a super chat. Paddle and Fish is in here again. All right, how do I get it? That's strange. I'm clicking on it, but I can't show it on the screen, but I can read it here. Paddle and Fish said, trying again, haha, I was born with hip dysplasia and then arthritis when I was in my 40s. Now near 60, it was getting stiff. It was getting so stiff and painful, I was considering surgery. But after, it cuts off on me, Paddle and Fish. I don't know how to see the rest of it. Oh, it says, oh no, 200 limit. Oh, I think maybe you cut off. Okay. I'm so sorry, Paddle and Fish. I can't see your full comment on here. But sorry you're dealing with that. That's no fun, having to deal with hip dysplasia. For those of you guys, let me just talk on it for a minute. Hip dysplasia is when you're born with the hip socket not being the right size for the ball. Usually it's too shallow, so it's not deep enough. The hip socket should be kind of deep so that it keeps good connection for the joint. But if it's more shallow, then it allows for a little extra mobility, which isn't good if in the long term, especially as you age. It sets up bad motion inside the hip joint. I think a lot of these people with hip dysplasia can compensate for the hip dysplasia problem by getting strong in the glutes, especially because the glutes suck the ball into the socket better. There's muscles, deep hip rotators, that are kind of like rotator cuff muscles, but for the hip joint. The rotator cuff muscles in the shoulder pull the ball into the socket in the shoulder, and I think the same thing's happening down at the hip. Those hip rotators are pulling the ball into the socket. So and those hip rotators, the thing is, they're on the back of the joint, right under the glutes. This is why I tell people the glutes is the key. We need to get those glutes strong, and consistently people get better in their hip pain and their knee pain, even their back pain, when their glutes are stronger and they're using them more consistently. So hopefully, I can't see the rest of your comment there, Paddle and Fish, but my encouragement to you is if you're not already working on your glutes, work on your glutes. If you have hip dysplasia or hip arthritis, it should help both situations. Hip dysplasia can get very severe in some people. They're usually born with it severe though, and they might need a hip replacement early on, like in their 30s or even 20s in some cases. But I would still work on glute strength in order to keep your hip replacement healthy, because that will wear out as well if you have a really bad muscle imbalance. Okay, I'm so sorry, Paddle and Fish. I hope I answered your question. I can't see it. I'm so frustrated that I can't see the whole thing. It cut you off there. Let's go over to the next question here as I get sweatier and sweatier. All right, Pearly Gaddison is on here. She's saying, Doctor, my back, the nerve in neck and back lower, scared to go under the knife, to have disc in lower spine, curving a C. What can I do for the anti-inflammatory without medicine? Oh, man. Sorry, now it shows up, Paddle and Fish. Oh, I guess another comment came in. Okay, sorry, I'm just trying to handle Paddle and Fish here. It says, after doing the exercise, especially the walking, the glute pain is gone. Oh, great. So it's working. I am still stiff. I have to take off my shoe to tie it if no pain. Good, Paddle and Fish. I'm glad that the glutes are working for you. That's, like I said, whether you have hip dysplasia and arthritis or just hip arthritis, glutes are the key. They're the secret there. All right, let's go back to, we were on, oh my gosh, I lost the comment that I was on. Let me go back. Oh, here we are, Pearly Gaddison. So sorry to hear about the nerve on the back and on your neck and your lower back. Yeah, I would be scared to go into the knife too, especially when things like this are happening, because this is often very preventable. You need to take care of the muscle imbalances, which is going to be in the abs. I'm sorry, in the lower back, it's going to be those abs. Going back to what I was talking about with that posterior pelvic tilt, that idea right here, when you're pulling when you're tightening your glutes, you should be sucking in your abs too. It should naturally happen. If it doesn't, then you need to be consciously making it happen. You need to be sucking in your abs a little bit, not to the point where it makes you like breathe awkwardly. You should feel muscles tightening, but you should be able to breathe. And when you do that, you take pressure off your lumbar spine, your lower back right here. Because think about it, if I'm sticking out my butt, it's going to curve my back more. That's the bad way to be, the anterior pelvic tilt. But when you tighten your glutes and suck in your abs, it actually decompresses your spine, which decompresses your discs in your spine and allows them to heal. But you have to be doing this on a consistent basis. You literally have to suck in your abs a little, like 10%, maybe 20, 30%, depending on how bad your situation is, and walk around like that, like suck it in and then go through your day like that, go to the gym like that, go to work like that, go to the store like that, because then you're constantly taking pressure off the disc in your spine. This is why people that wear a corset or like a lumbar brace, a brace for their lower back, will feel better because they get that compression and it allows their muscles in their back to not have to work so hard to stabilize their back. But if you suck in your abs like that and get your glutes tight, it also shuts off the back muscles some. So it takes that compression off your spine and allows your discs to be a little bit happier. You can't rely on a brace though, because your muscles will just take the day off, but they'll get weaker and weaker over time, the ones that you should be using. So you have to get your abs stronger, your lower abs specifically, because they work with your glutes to get your pelvis in the right position to take pressure off your spine. So I hope that helps there. We got another super chat. Kimberly coming through. Hey, Kimberly. She says, any help for hip bursitis? I broke my hip 1 year ago and had a total knee replacement, TKR, 4 months ago. Lots of muscle imbalance, but I'm working on my glutes. Great question. That muscle imbalance, Kimberly, that I talk about with the glutes getting weak and then causing the muscles in the thigh to work extra, that sets up the same muscle imbalance that causes hip bursitis. Hip bursitis is when bursitis, it's a fluid-filled sac that reduces friction. It's going to be on the outside of the hip, like right in here. That's often where it hurts. That hip bursa can become irritated if you're using the muscles on the side of your hip too much. And so when you are not using your glutes, you'll tend to use the muscles on the outer part of your hip, and that can start to rub that bursa too much and cause a bursitis. It can even cause swelling. It's definitely tender and painful for a lot of people. But it's the same fix that you're going through to strengthen your hip and your knee by doing the glutes, by getting the glutes stronger and walking with the glutes and becoming very glute conscious, being able to activate the glutes whenever you need to, using them as you walk, using them as you do your everyday things, doing some of the exercises that we talk about online, like baby squats and bridges and other things that involve the glutes. Doing all those exercises will help hip bursitis as well, Kimberly. So you're doing the right thing. Just keep going. If anything, if the hip arthritis started to flare up more recently, then I would check your form, check your technique to make sure that you're not using the muscles more on the front side of your hip. So I'm talking about like right here where your pocket is in your, like if you had pants on with pockets, that muscle, the TFL muscle, is the one that activates too much and it contributes to hip bursitis. So whenever you're doing glute exercises, you need to be using the back of your hip. That's more so where the glutes are. All right. Hope that helps you, Kimberly. Paddle and Fish is on a roll here. Hey, thank you so much, Paddle and Fish. I appreciate your comments here with the super chats. Even if the stiffness can be fixed, as long as I don't have pain, I will be avoiding the knife. I have 2-inch leg length difference too. Yeah, I'm with you on that. I think unless the leg length difference is too much of a problem for you, and the stiffness is too much of a problem, which the stiffness should improve. It should improve over time. It just takes longer to improve because it requires the cartilage to rehydrate, which takes weeks to months even. But the pain you can usually start to get down within days to weeks. Sometimes it does take months for people, but for the majority of people, within weeks, they're feeling tremendously better after they've gotten their glutes strengthened a good amount. So I think you're on the right path, Paddle and Fish. Keep going. That way you can have more fishing days. Update your profile picture with an even bigger fish. That is the life right there. You're doing great exercising your glutes, Paddle and Fish. Keep going there. Let's see what we got. I'm going to go back to my other list. We got this one already. Oh, that was Kimberly earlier. All right, here we go. Salt wrap. Can you tell me about the product, Mike Allen? Yeah, you saw a video that we posted recently about I think you're talking about that. I'm not sure. We posted a video about, we were kind of reacting to another video of somebody that put Vicks Vapor Rub, salt, and a dryer sheet, and they wrapped it around their knee. I don't think it's the best thing for you to do. You could try it. You might have a different experience, but I don't think the salt's going to do much or the dryer sheet. I think it's the Vicks vapor rub, if anything, and it's going to be short-term pain relief. It's not going to be anything long-term. But I don't know of any major health benefits with salt, like putting a salt wrap around your body part that hurts, like your knee, for instance. I would say you can try it, but if it doesn't work within 1 to 3 attempts, I would probably dump it. I wouldn't be surprised if there's some people out there that say, hey, the Vicks Vapor Rub, dryer sheet, and salt hack worked for me. I'm going to keep doing it. Then I'll say, fantastic. I'm not going to ding you on it. Go for it. Just know that it's not going to solve the long-term problem. It's only designed to give you some short-term pain relief, which ice could do that. Heat can do that. There's other things you could do. Hey, at least it's not pain medication. I'm always a fan of that. But try the massage gun. That's always really helpful too for on your thigh muscles, not on your kneecap. So that's what I have to say about that, Mike Allen. V8 Turbo has a question. Can I ask you, is selenium can stop ejaculation during sleep? I'm not going to answer that one. That's like a prank question right there. All right. Kundan Shah, can you please suggest some exercises for cervical stenosis? Yeah, I can. Cervical stenosis is when the holes in the side of your neck start to close because of the position of the bones in your spine, in your neck, and also the discs, they get squashed. So the holes, the openings in the spine where the nerves come out that go down into your arm and a little bit into your chest and into your head, those nerves begin to get pinched because the opening shrinks down. It often happens in people that have this forward head neck posture because in that forward head posture, their neck bones start to close. Oh, I even just hurt my neck getting in that position. So the main thing that I tell people is you have to do a combination of a chin tuck. So like making a double chin, like a baby double chin. So an all-out double chin would be like that, but you want to just do a subtle one. And then once you do that subtle double chin motion, you'll feel the muscles in the back of your throat working. Those are the ones that help to straighten out your spine in your neck and take some of the pressure off those discs and open the holes back up. But that's not all. You also have to now, holding that position, train your shrugging muscles. Like I was saying with the rotator cuff problem earlier, when you shrug your muscles up and hold your neck in that double chin position, that motion is gold because now you're training your upper trapezius muscles to hold your shoulders and your neck up in the right posture along with your deep neck flexors, those ones that make you do the baby double chin. Doing that on a consistent basis, training your arms to shrug every time you reach up when you're going to reach up for the cabinet or something high, that's what's going to position your spine the best possible to take pressure off the discs and the openings to relieve the stenosis. So make sure that you're doing some sort of overhead reach activity. Hope that helps you, Kundan. We got another super chat. Paddle and Fish coming in again. He says, great news. I will continue to do it for sure. Do you have any YouTube videos on abdominal exercises? I looked and couldn't find. Thanks for the chat. Yes, we do. I can't think of exactly where it is on YouTube or where, what the name of the video would be, but we absolutely do have abdominal related exercises. They might be in the videos that talk about lumbar stenosis. I'm pretty sure they are, Paddle and Fish. You know what you can do, and this goes for everyone here on this chat. Go to our website, epmanualphysicaltherapy.com. You can find it in our bio or in the description of whatever social media platform you're on right now, and find the contact us form and drop the question, hey, where's that video that has the abdominal exercises? I have people answering those emails all the time. If it's the weekend, you might need to wait till Monday till we get back to you. If it's the middle of the night, you might need to wait till the morning till we get back to you. But during the week, we have people answering those questions all the time. So if you need to find a specific video, if you can't find it after doing your own search, please communicate with us. We help people like that out for free all the time, just to point you in the right direction. So that's my best answer for you, Paddle and Fish. Go look for it. If not, send us an email on the contact us form. Also on our website, we have like a little chat that pops up. If you just, any page, there'll be like a little pop up in the bottom right corner, and you can chat with us there, and you can ask that question there as well, and we can get to you there. Hope that helps you. Whew, tons of questions today, guys. I can't even work out, but that's okay. I love answering questions. We were on who's your cramps in muscles, back of thighs for 2 weeks. Need to strengthen glutes? Yeah. The reason why your hamstrings are cramping on the back of your thighs is probably because they're overworking. They're doing too much. There's multiple reasons, but this is probably the main reason. And the reason why they're overworking is because your glutes aren't strong enough. They're not. The glutes aren't doing their job, and so the hamstrings will take over whenever the glutes can't do their job. The quads will take over too, depending on the motion that you're doing, the activity that you're more doing. I think there's also some genetic issue to it. Another reason why you might get hamstrings to cramp is because you have sciatica, which could be results of the weak glutes. Like it could be an indirect connection because of the nerve getting compressed. The pelvis can shift. There's issues that happen in the bones because the glutes can't hold the bones together well enough. And then you might also have a problem up in the spine with sciatica that's presenting as cramps in the hamstring muscle. People get cramps in the calf muscles as well, even in the arch of the foot with sciatica. So a big root problem of that, though, is glute strength, because glutes are foundational. They're moving your body forward. They're a big muscle back there. They're designed to push you forward. They give stability to your spine. They give stability to your legs. If you don't have good glutes, you're going to be in trouble at some point or another. Mindful138 says, what if it's not arthritis in the knee, but sarcopenia? I guess. I mean, sarcopenia doesn't hurt. Sarcopenia doesn't cause stiffness. But I think that for those of you guys who don't know what sarcopenia is, sarcopenia means muscle shrinking. Sarco, the Latin for this, sarco means muscle, penia means shrinking. Muscle shrinking, muscle atrophy is another way of looking at this. It doesn't hurt. But the result of having less muscle to control muscles, to control joints and bones and all that, usually means you're going to be putting bad forces on your joints, which can cause knee arthritis and hip arthritis and other issues like that. So I hope that answers your question. Dara Patel, Dr. David, your info here has been so much help. Thank you so much. You're welcome, Dara. Please provide some info on gluteal amnesia. Oh, I love that. I never heard people call it that. Impact on knee snapping and whether it could impact any pinching in shoulder joints. Good. Info on gluteal amnesia. What Dara's talking about here is when your glutes don't know how to work, like when they don't know how to activate, when they don't activate, you try to activate, like you think about, okay, make my glutes work. Your brain is saying glutes turn on, but your glutes just don't work. They don't activate. Other muscles activate, in fact, like your thighs, your quads, or your hamstrings activate. That can contribute to your knee snapping, so that like crunchy snapping noises in your knee, because it's going to make your quads and hamstrings activate more. Because if you're still walking around doing your everyday activities, you're going to be using your thigh muscles more, and that can pull the tendons and the ligaments in your knee joint more. As far as pinching in the shoulder joint, I guess indirectly it can, depending on if it's changing the way you walk, if it's changing the tension in your lower half, that could affect the upper half. But I would be more inclined to say that there's probably some sort of neck shoulder problem that's going to be more directly affected in the neck and shoulder in order to help the pinching. So it's usually like a shrugging problem, like you're weak in the shrugging muscles. When you fix that, it tends to make things pinch less in the shoulder. Shrugging muscles are key. They're like the glutes of the shoulder, of the neck and shoulder. I often find people with shoulder problems and neck problems that don't have enough strength in their upper traps. These muscles right in there between the neck and the shoulder, they actually go up into the neck and they go out to the corner of the shoulder, and they help to control the shrugging motion like that. But when you reach up overhead, you should be shrugging as well. Hope that helps you out, Dara. All right, I got to do some deadlifts here. I'm slacking it. Halfway through the call already, more than halfway. Nikki Fields from Facebook says, hi, I have a medial meniscus tear that's very small that they said won't heal. What are the best exercises to do? Okay, this is one I can exercise too. Let me get my deadlifts in. Small medial meniscus tear that won't heal. It depends on how you define healing, because if you define healing as the tear reattaching itself, I don't think you can count on that. If you define healing as you feeling better and being able to walk and exercise and do all that you want to do, then we have a shot. We definitely have a shot at doing that. The best thing to do is to fix a muscle imbalance that's causing you to put too much pressure through the meniscus and probably cause the tear to happen. So you need to get the glutes stronger. Now, I'm working out my glutes right now. I'm working out other muscles too, but I'm focusing on using my glutes as I'm doing this lift. But you might need to first make sure that your glutes work, that you don't have gluteal amnesia, as Dara said. If you have good glute activation, then you need to be using your glutes in everyday activities like walking. Like, you think about walking, every time you bear weight on one leg, the glute on that leg should activate, and then the other side. People don't consciously do that all the time. But if you train yourself to do that, now every step you take is going to be one with less pressure through your meniscus. Super helpful. That will translate to more activities that you do with your glutes, like when you go do the laundry at home or cook a meal, walk around town, all the things you have to do. If you can make them more glute focused, you're going to be consistently taking pressure off the meniscus so that you can allow it to heal, Nikki. I hope that makes sense. That's the number one thing to do. You just have to gradually increase the activity based on how your knee can take it without hurting. You should not be hurting, by the way. Like, some people will force you, some health professionals will say, force your way through exercise, but I don't think that's a good idea. I think you should be able to do exercise that your current cartilage, your body can take without becoming injured. That's the best way to go about this, so that you can gradually get the meniscus you have right now to heal, and then to get denser, to have better integrity, so that it can take more activity. Hope that helps you, Nikki. Do we have any super chats coming in that I missed? No, none so far. Okay, just want to make sure not to miss you guys if you're doing a super chat. All right, we have Annalisa. Hey, Dr. Dave, question from Toronto, Canada. Big fan. Oh, thank you, Annalisa. I'll see where your question is here next. All right, Monica McGowan. Best way to treat swelling after an MRI, keeping me from reaching beyond 86 degrees flexion, 7 days post MUA. And MUA is a manipulation under anesthesia. 10 weeks post total knee replacement, TKR. I ice 20 minutes at least 3 to 4 times a day. Dang, so sorry you're dealing with this, Monica. So you're asking for how to beat swelling after only being able to get to 86 degrees flexion, and you just had a manipulation under anesthesia a week ago, and you had a knee replacement a month and a half ago, and you're icing a lot. Honestly, Monica, I wonder if anyone's loosened up your quads. Your quads often get so stiff. I would look at hamstrings too. Hamstrings, quads, and even the calf muscles. I would go massage the heck out of your muscles in a way that doesn't hurt. It should feel good. It should feel like it loosens you up overall. Maybe in the moment while you're digging in there, it hurts. But I would go get a massage gun if you don't have one already, and go to town on your leg. If you're seeing a therapist that knows how to do massage, manual therapy type techniques, I would ask them to do so and see if they can gain some motion out of that. Often that helps. But I would get in those quad muscles, especially. If you were here in person, I had my hands on you, I would dig in those quad muscles in a way that feels good, not in a way that makes you wince or cry. And I'm willing to bet you can probably squeak out another 5, maybe even 10, or in some cases, you'll see people get 15 or 20 degrees of knee flexion. And it's just that those quads are so stiff, they hold your knee bent. Let me see if I can show it here. Oh, a super chat came in. I'll get right to you. So the quads right here, they'll shorten, they keep your knee kind of straight. And when you want to bend your knees, they don't want to give. So if you go loosen this up, then all of a sudden you get a little more motion, and you loosen it up some more and keep it loose. You might even be able to get more motion. So I would focus on loosening the quads. Big improvement for a lot of people that goes unseen, and medical professionals don't always know to do that. All right, we got another super chat here. Let's take care of you. Ray Plata. Thank you for your support, Ray. Appreciate it. My daughter wants to be a physical therapist, college in the fall, kinesiology major. Any advice? Oh, yeah. Awesome. Fantastic. Congratulations to your daughter. I did a kinesiology degree. I had my bachelor's in kinesiology from the University of Texas at Austin. And then after that, I went to Texas State University for physical therapy. My best advice, I did it the hard way because my kinesiology degree wasn't a pre-physical therapy degree, because at UT they didn't have that. There's no PT school at UT, so they didn't have a bachelor's degree that sets you up to go into it. But all the Texas State kids that got their bachelor's did. So my advice is if you can, go to a school that also has a physical therapy school already built into it, because then there's probably going to be a degree plan that gets you right in. If not, it's okay. You can still work on it. You just have to make sure you know all the requirements and take all the classes, the prereqs, and all that stuff. The second piece of advice, Ray, is make sure that for your daughter, make sure that you know that you want to do this, because it's a long road. It's a long road. A lot of people don't realize this, but it's as long as a lot of doctors go to school. I went to school longer than a lot of surgeons go to school. For just my physical therapy degree, it was about 7-8 years, but then I went to postdoctorate training, which was another 5 years on top of that. And I can't tell you how many patients I've had who have relatives that are doctors, or they're doctors themselves. And once they add up all the years of school and training I went through, they're like, whoa, that's like more than some surgeons. I'm like, yeah, that's why I know what I know. But I really wanted this. I really enjoy this stuff. So go volunteer in clinics, go volunteer with, go talk to physical therapists. A lot of clinics will take them as volunteers. That way you can see what you're getting yourself involved in and see if it's what you want to do. Other than that, learn. Don't get hung up on the grades. Get hung up on learning what you need to learn to help people. That was something that I was just talking to my son about recently. Is I had a lot of people. I had friends, classmates in school that were all about the 4.0, and that's cool. It's a good goal for sure. But sometimes they'd overdo it and get stressed out. And I was like, I want an A, but if I get a B, but I'm okay with it. I learned a lot though, and I learned what I need to learn so that I can do a good job with my patients, with you guys here right now. But I didn't have an A in every class. But that's okay, as long as you learn. So that's my advice. Got another super chat here from Dr. Q68. No comment, just a donation. Hey, thank you so much, Dr. Q. I appreciate it. Love those. Helps our team out tremendously. Let's see, what question do we have next here? I think we answered that one. Okay, Monica says not MRI, but manipulation under anesthesia. What was Monica's question from before? Oh, here it is right here. Best way to beat swelling. Oh, after the MRI, you meant to say manipulation under anesthesia. Oh, man, that's tough. You're going to swell. There's no way around it. I mean, they are breaking your knee essentially when they do that in a controlled way, you know. They're trying to break scar tissue. Elevation, ask the doctor because you might need some pain medication, some anti-inflammatory medication. You just need to make sure that you stay. Don't do anything. Don't do anything that hurts it. And talk to the doctor, because the doctor might tell you to move in a way that hurts, but they're going to know best based on the technique they did. So the best way to beat swelling after a manipulation under anesthesia is to get with your doctor on how much you're allowed to move, for sure. All right, we have another super chat that came in from Pratt. Whew, we're nearing time here. I got like 5 more minutes. So anybody that wants to get in a super chat, get it in now. Pratt says, hi, Doc. How should you balance strengthening and stretching exercises? Should you do them regularly and both together, or what is your opinion? Oh, good question. Good question, Pratt. So I'll do calf raises right now. so I can stay here and look at you guys in the eye. I think you should think about how flexible you are and how strong you are. And this is a very subjective question, right? I get that. I understand that I'm asking that. But based on your lifestyle, based on what you do, based on what you need to do, there is not a big reason for you to gain a lot of flexibility unless you're going to go into like gymnastics or something like that that requires tons of flexibility, maybe like Pilates, yoga. And as a result, if you pursue that, like let's say you're into yoga, that's fine, that's great, that's excellent. You're going to build your flexibility in yoga, and maybe you do spend some extra time focusing on your flexibility so that you can do yoga better. But what I would encourage you to do, if that's you, if that's your goal, is still strengthen, because yoga isn't fixing a lot of muscle imbalances. It's not helping you with your back pain directly by fixing the muscle imbalance or hip arthritis or knee arthritis. It is increasing your flexibility. Undoubtedly, people that don't do yoga and start to do yoga, they get more flexible. That happens consistently. But you still need to strengthen. So now you have to ask the other end of the question is, do I need more strength? And if you know that your glutes aren't active, or your abs aren't active, or your shrugging muscles, your traps aren't active, then go spend time on that. So to put it simply is work on the weakest part of all of those. Between strengthening and stretching, I would work on the one that you feel it needs the work. There isn't like a perfect balance. It isn't like, I don't have an answer for you, Pride, of like, work on stretching for 20 minutes and then strengthening for 40 minutes. And you should do 60 minutes of exercise 5 days a week. And that's what the research says. That's not the case. It's an individual situation, and you have to take into consideration where your limitations are. There are some people that are very naturally flexible, and they don't need to be stretching. They're already flexible. They probably need to work on strength. And there's the other part. There's people that are naturally strong. This guy, like I don't have trouble lifting weights. I enjoy it. I need to work on my flexibility more so. But then I have to take into consideration, what activities do I need to do throughout the day that require a lot of flexibility? And when I think about it, not much. I think I'm flexible enough right now. Does that make sense? So if you have the flexibility that you need to do your current daily activities, don't stretch. Maybe some maintenance stretching, if anything. If you have the strength you need to do what you have to do right now without pain, without any issues, then you don't need to really pursue strengthening unless you choose to. And same thing with the flexibility. You can choose to have more flexibility, but it's your decision based on what you think you need. I hope that helps you out, Pratt. All right, who's next here? Let me reorient myself. One moment. Samrina says, hi, please tell me, can I do knee or glute strengthening exercises when I have mild to moderate knee pain? It depends. It depends, Samrina. You can exercise if you have knee pain, if the exercise doesn't make the knee pain worse. In other words, if your knee can tolerate the exercise without hurting more, go for it. It's a good thing. It's probably going to benefit you. And I would focus on glute-driven exercises if you have knee pain that's related to a muscle imbalance. But yes, in short, yes. But if any exercise aggravates your knee, then no, you should not be doing exercises with knee pain. So you have to figure that out for yourself. What exercises don't hurt you? Do those. Hope that helps, Samarina. BK, Burger King. BK's in the house. There's a Burger King like 2 blocks away, so that's why I thought of that. Internal hip rotation causes back of knee pain. Doctor said it is knee arthritis, even though x-rays show no narrowing of the joint. I disagreed and refused steroid injections. Any advice would be great. Hip internal rotation, which means turning your leg this way, like with your foot going inwards. That tends to add more compression to the knee joint, especially on the inner part of the knee. And it can cause pain on the outside, on the back of the knee and on the front of the knee. It could be like mild arthritis, which doesn't show joint space narrowing inside the knee. If your knee pain isn't that bad and you're able to refuse the steroid injections, fantastic. It sounds like you're probably in the perfect space, BK, to fix this problem really fast by fixing the muscle imbalance. So like going through the knee arthritis recovery program. I would recommend that, which by the way, we aren't taking any more clients for the knee arthritis recovery program. We had to close enrollment because it got full. We're at capacity there. We're going to hit it soon with our hip arthritis recovery program. But what we have for you right now, if you wanted to start, we have the first phase of the knee arthritis recovery program. If you go to our homepage, epmanualphysicaltherapy.com, you'll see the buttons for it. And you can start on the knee arthritis recovery program right now and begin to get some of the benefits out of it. It's free. So you just go over there and you don't even have to log in. It's on the website. You can just start the program. So I would recommend doing that, BK. Start with that. You'll probably get some relief right away. And if you need to go to the next level, then you'll see what needs to happen for you to do that based on the program. All right, guys, I got time for one more question here, and then I got to go. It's going to be Sue Walton. Dear Dr. David, pain behind the kneecap. Pain behind the knee, up the hamstring on one leg. Which are the best exercises to help ease this? Whew. Sue, you've got to get those glutes going. Hamstring, so it could be sciatica. It could be a hamstring strain. If it hurts right in the knee, like right behind the knee, that could be sciatica. The nerve runs right there. It could be something going on in the knee joints as well. But I would start with glute exercises. Make sure your glute can even turn on, because if you can't turn on your glute, you're going to just make this whole problem worse by activating your hamstring more. And then I would pair it with abdominal exercises, lower abdominal exercises. You have to get those lower abdominals working with the glutes in order to get the best outcome, to take pressures off the nerves, to make sure you're not overusing your hamstrings if this is just a hamstring problem, and balance out the forces. This is what fixing a muscle imbalance is about. All right, guys, I got to go. I am at time. Quick announcement, I won't be here next week, but we are still doing a live stream. So you'll see it. Our recovery coaches, Raul and Jay, will be hosting the call. They'll be in here working out. So you can still show up, get questions answered. They're fantastic. Those of you guys that are on here, if you've had a question answered by them, please drop a comment and say, thank you, Coach Raul. Thank you, Coach Jay. They'll love to see that. They do a great job with the members in our programs, the members in our knee arthritis and our hip arthritis program. They're helping people out with rotator cuff problems. They know our programs in and out. Jay and Raul are program specialists in my company, so they can help you out. They'll be here answering your questions next week, guys. All right. Thank you so much, everyone. See ya in 2 weeks. Raul and Jay will be with you next week. Bye-bye.